A quick overview of what we're going to be talking today. We're going to be covering quite a lot of topics, so I am going to be speaking quite quickly. Do feel free to stop me at any moment if you do have any questions. Otherwise, we'll try to address hopefully most of your questions through the presentation today as well. I do want to start by asking whether you had any particular expectations from today's session. What would you expect from a brief webinar on wellbeing action plans? We'd love to be able to make sure that if we do continue to do webinars like this, that we really hit the mark. So feel free to put in the chat box if there are any current situations that you might be responding to that the Wellbeing Action Plan you'd hope will be able to address, or whether you've been discussing anything with your current colleagues that, again, it related to wellbeing that you'd think the Wellbeing Action Plan might be able to help address. Fantastic. Thanks, Julie. Yes, hopefully I could give you some tools to help you with this already. As with implementing any good strategy, it's important to understand the initial parameters before launching into developing a solution. Thanks, Deborah. And so today I want to start this process by asking a few questions just to have that initial diagnosis as to where you're starting from. Of course, there would be a lot more considerations than just this in thinking about where you guys are at within your organization in terms of your wellbeing journeys. The first question that I want to ask is, how many team-level conversations about well-being or mental health have you facilitated, say, in just the past 2 weeks? Feel free to put your response in that chat box there. Tracy, 0, not a problem. Hopefully we'll be able to help a little bit more with that. 1, yep. On a personal level, yes, exactly. That would be usually my next question as well. Fantastic. Quite a mix here. Sounds like quite a lot of people are very proactive with this already. Fantastic. So today, what I want to be doing is, for those people who are already doing something like this already, we want to be able to provide a framework to guide some of these discussions. And as well as that, for people maybe who hasn't done this before, maybe we could help you give a little bit more of a direction to move towards as well. Fantastic. And the second question I want to ask as well is, has any of these things that I've listed did any of these things, sorry, that I've listed make it hard for you to facilitate team-level well-being or mental health conversations, maybe in just the past 2 weeks? So I've got a range of different options there for you. Feel free to suggest any other things that you've experienced recently. Yes, it's pretty difficult not being around, Shannon. Yes, yes. Time, that's a big part. Yes, people being busy, absolutely. Yeah, sometimes it's really just not in your direct hands, that's true. Elisa hopefully will give you a little bit more knowledge on how to approach this as well. Yes, that's right. Yeah, just individual buy-in, etc. And hopefully we'll get to touch on that. Lauren, big challenge at the moment, physical office, not being in a physical office space, that's quite difficult. Fantastic. I'm just going to move on, but some great responses there, very informative for me as well. Thank you. So I want to just start by thinking, what is our goal when we engage in these kind of well-being and mental health oriented conversations within our workplace? Now, already when I made that statement, I feel like a lot of us know what the practical goals of having such discussions might be, right? Improving mental health and well-being practically has a lot of effect in terms of organizational outcomes. But today, what I really want to impress on you today is the pathway by which these conversations should hopefully achieve these practical goals as well. And the key pathway that I want to touch on today is the pathway of psychological safety. We're trying to develop, through these ongoing conversations related to well-being and mental health, a strong culture of psychological safety. That is, we want to create an environment and culture in which team members feel like they could openly and honestly speak up without any fear of ridicule, judgment, or retribution. Very, very simply, just for people to feel safe to share within that workplace. This, by developing a culture of psychological safety, this is the most significant factor in predicting the cohesiveness, effectiveness, and success of a workplace team. So how do we do this? Well, one of the strong ways towards building psychological safety conducted by most teams is by intentionally creating challenging conversations and work through them as an organization, whether it be between an entire workplace or between individuals. We understand that having these kind of conversations are kind of where we're sharing personal information about our intimate undergoings is kind of taboo within the corporate workspace. And so giving people a situation and a context to be able to do that in a safe manner can help a lot. I do want to emphasize that psychological safety can't be demanded or forced upon an organization. It must be developed. It must be developed upon a foundation of mutual trust between individuals. So that being said, as a leader, it's important to model vulnerability, to facilitate and to create contexts where psychological safety can be developed. But it's also important to do it in such a way that doesn't leave the individual overly exposed, whether it be the leader or whether it be the participant sharing about themselves. And what I really want to emphasize here is the best way to think about the process of developing psychological safety is through a stepped approach, through a series of small steps, each creating small amounts of tension. We could develop higher and higher levels of psychological safety. And when I say tension, what I mean is that sense of tension around whether the individual within a team can trust you as a leader and facilitator, and whether they could trust each other to be respectful through, say, conversations about individuals' personal lives or their personal well-being. And through kind of working through that small degree of tension, developing trust, hopefully we'll be able to continue to build that cohesion and trust individually to get better cooperation and organizational outcomes going forward. So as the facilitator, your job is to model and these values and to protect these values as well, both during well-being conversations, but as well as that outside of these conversations as well. Of course, the overall goal of a system like this isn't just to develop that level of psychological safety just between you and the individual you're talking to. The goal is to have people feel safe when talking to each other, and for that level of safety to continue even if you're not in the room. Now, I'm going to start talking about the Wellbeing Action Plan, but I know what I really want to impress upon you is the Wellbeing Action Plan is a plan that is quite, that requires a good deal of psychological safety to implement in the first instance. You might not be in the position to be able to implement this straight away, but it might be a good way of thinking about where you want to be heading towards and the level of discussion that you want to work towards as an organization as well. Let me give you a little bit of an overview as to what the Wellbeing Action Plan looks like before I talk too much more about that. The Wellbeing Action Plan is based on Mary Copeland's Wellness Recovery Action Plan. It is an evidence-based system for promoting mental health. This system is more based on an individually guided effort towards that. It gives the individual a list of questions to be able to identify what it is that determines their individual well-being, and then gives the tools to that individual to be able to manage their personal well-being levels. Uniquely, the Wellbeing Action Plan emphasizes a mutually determined set of actions, one that can be shared between the individual and a manager within a workplace. I do want to emphasize the Wellbeing Action Plan is not a intervention that's been developed and unique to Uprise. It is actually developed by a wider set of organizations, and there's quite a lot of research about this. If you, there are additional resources about the Wellbeing Action Plan if you Google it, but from us here today, we just want to give you a very a structure that we've seen to work for us, and you can always add to this if you want to as well. We always suggest to start a Wellbeing Action Plan by communicating confidentiality. Now, the reason why we do this is because we want to build some trust before the implementation of a Wellbeing Action Plan by establishing clearly what happens if the individual does choose to share information about their personal lives with you or the organization. So it is important to clearly articulate the boundaries of that. So a few things to touch on. First, it's good to explain that the individual doesn't need necessarily to share their plan with you, but if they do, it can be something that you can mutually work on. Also, it's important to explain that your aim is to keep the plan confidential, but it's important not to promise full confidentiality. There might be instances where you might need to, if the situation is a critical or emergency situation, to speak to a mental health professional or to a member of HR. So it's good to be able to set that expectation up front so the individual knows what it is that your level of confidentiality, what level of confidentiality it is that you're committing to. And finally, it's good to also articulate that individuals can be given an opportunity to share their action plans in team meetings, but that's entirely up to that individual, and that you won't be sharing anything on their behalf without express permission given by that individual. Fantastic. Now, in terms of the Wellbeing Action Plan template that I'm going to walk through, again, you can download that as part within the chat box just here, as well as that, of course, the Wellbeing Action Plan template is within the Uprise platform for our current customers, and I'll show you how to access that going forward as well. Let me have a look through the questions with you. We have 9 questions that we cover. The first 2 questions, what helps you maintain your well-being when you're at work, and what can I do as your manager to support your well-being? We always find that it is helpful to start by looking at solutions as opposed to the problem, because it just frames the rest of the conversation in a more constructive light. So starting with possibly what can we do to help support your well-being is a great way to start before looking specifically at what some of those triggers for poor well-being might look like. Being able to mutually discuss some of these things is really, really helpful, especially, for example, this 4th question here, being able to talk about what's happening at in somebody's home gives you some really important context to understand where that individual is at. But of course, sharing that information is deeply personal. So again, it is very important to communicate clearly with the individual as to what you will and won't disclose through that confidentiality conversation. Another thing you'll note through these questions is we provide a lot of example answers to the questions that we're asking. This is something that's been modeled to me by my CEO here at Uprise, and I've adopted it ever since. I find it's just a really good way to show that you understand the potential issues that individuals might be facing within in terms of well-being, but it also gives the individual some prompting to help them articulate something that maybe they haven't had the chance to before. Yes, Rachel, there's 9 questions in total. Yes, thanks, Larry. And just quickly to look over the rest of the questions as well. If you do feel overly stressed at work, is there anything that I need to facilitate so that you can de-stress? And again, what is your preferred working style? As you can see, there's quite a lot of information here to both help you understand where the individual is at, but also develop mutual solutions. Question 7 and 8. Are there any early signs that we might notice when your well-being is starting to go down? Now, with our current context, with so many people working from home, this question is more important than it has been in the past, and we'll talk a little bit more about this, but in the past, when we see each other every day in the office, it is a little bit easier to perhaps observe when an individual's well-being might be going down, but of course that is unique to each individual, and it's helpful for that kind of mutual communication to happen before time so that you can recognize it. But now we're working from home, it's a lot harder to be able to identify when an individual's well-being is going down. So having this communicated up front, and then from there being able to kind of work out a pathway mutually as to how to address that is really, really important. And the last question, of course, is summarizing the reflections that we've gone through earlier into some very specific goals, some SMART goals. I'm sure a lot of you have heard of SMART goals before, so I won't explain too much more into detail in regards to that, but being able to put legs onto personal reflections in a mutual way is an essential element of the Wellbeing Action Plan. Fantastic. So I know I'm running out of time, so I should move this a little bit more quickly, and I won't give you an opportunity to provide responses. Here, I do want to talk very quickly as to how to implement your wellbeing action plans within a team context. Again, here I'm trying to interweave the practical elements of implementing a wellbeing action plan with the overall goal I mentioned earlier around developing psychological safety, right? So psychological safety is modeled by leaders before the conversation, within the wellbeing conversation, and the carrying out of the wellbeing action plan. And so, but from there, after applying the plan itself, it's important to follow up very, very well with the wellbeing action plan. It's from that follow-up that changes the culture. So on a practical level, I'd really suggest to introduce wellbeing action plans at a team level. I will advise taking a little bit of time with that, being able to express that well. Again, articulating understanding around confidentiality, articulating the context of what it is that you're trying to achieve, being able to articulate the kind of mutual commitment that you're hoping to engage in through the wellbeing action plan. I'd advise rolling this out on an individual level, and then depending on the context of your team and the level of psychological safety that's already been pre-established, considering whether you want to roll it out on a organizational level as well. So on an interpersonal level, I'd advise sending an email to each individual so that they would complete those 9 questions and return it to you. And again, critically following that up by scheduling some one-on-one meetings to discuss their wellbeing action plans if the individual chooses to do so. And through those discussions, of course, you can flesh out what those plans look like. If your level of psychological safety is high, then it might be appropriate to invite them to share individually within a team meeting. Of course, I'll finish this a little bit and then I'll reply to that earlier. Yeah, so invite each of them to the team meeting, pre-establish whether individuals want to share or not before you get to that meeting. And then individuals, if it is appropriate, again, could sit down and use that time to interact with one another and discuss their well-being action plans at a team level as well. Most critically, the last step here is for you to individually take a record of their individual needs and goals and to follow them up as well. How would we introduce the Wellbeing Action Plan on team level? Look, there's many different ways you can do that. Of course, you can talk through it in a meeting if you do have the opportunity and time to do that. With this tech-laden time that we live in nowadays, pre-recording a video and putting that as part of the email that you send to individuals could also be an option. It means that it's left up to the individual and their personal initiative to, of course, engage with it. But it is a valid way of doing it as well. Follow up. I know I've talked about this a few times already. If you're a current customer, if you need a little bit more resources in how to follow up, of course, feel free to book a time with one of our coaches who could help you through that process, whether it be role-playing, troubleshooting potential issues that you might see, etc., etc. If you're not a current customer, then maybe finding a project manager to make sure that individuals are followed up. And I will talk through very quickly some of the skills involved in that. And again, sorry, I know I'm running out of time. For the team meeting itself, what would we need to prepare? I'd suggest starting with a preparing a team well-being exercise. Now, I know a lot of organizations tend to use mindfulness exercises as a team well-being exercise. That's quite popular at the moment, but of course there are lots of other type of activities, such as get to know you games, trust exercises, etc. Definitely try to choose something that won't be considered cheesy within your organization. The goal of that exercise really is just to set the tone of the meeting. Before the meeting as well, do inform your team as to what the meeting is about, the context of why it is important, etc. And of course, schedule that particular time in. During the team meeting as well, again, articulating very clearly as to why that Wellbeing Action Plan is conducted, why you're doing the meeting together, what you're hoping to achieve, etc. Again, try to develop that psychological well-being by setting solid expectations. And again, start with that team building exercise, set that tone, invite discussion, and then allow individuals to share their well-being goals if that's appropriate. And then, of course, to follow up again, individually do write down their goals, and then moving on from that, check in to see if they've hit their personal goals and do help resolve any barriers to hitting those goals as well. Now, I do want to skip through a little bit here. We're going to cover how to recognize the early warning signs of when somebody's going through poor well-being, but hopefully individuals would have given you some feedback in regards to that. How to have a conversation in regards to some well-being, somebody with poor well-being, and again, I won't touch on that too much today, but there are modules on, say, mental health first aid training, which covers exactly this. So we could give you more information about that. If you request it after today's session, just put that information in the feedback section. One thing I really, really want to hit hard on is that your goal as a facilitator isn't to be the individual's therapist, right? Like, what is the difference between a therapist and being able to support somebody? Being able to support somebody is to advocate for them and to point people towards solutions. Being a therapist is trying to help them resolve the situation. And most of the time, being able to support someone is really, really helpful so that you can give them the ability to then seek out ways to resolve the situation. But it is somewhat dangerous to have that individual rely on you just because of the context. And so the goal in supporting an individual is to refer that individual to further support if that's what the individual requires. There's lots of different paths towards that. You can refer to coaches who are on Uprise or to your current EAP. You can refer them to a GP to get the mental health care plan, or to Lifeline if that's appropriate as well.